Hi, and welcome to the Urology Consultation Series. In this episode, we will hear a consultation between Gary, who is a 60-year-old patient, and between a consultant urologist. Gary presented with bothersome waterworks symptoms.
Good day, Gary.
Good day, doctor.
How can I help you today?
I have been having difficulty with my waterworks for the last 2 years or so. The flow is poor. It stops and starts and takes a long time to empty my bladder. I am also going to the toilet more often, and occasionally I feel a strong urge to urinate immediately. Unfortunately, I had 1 or 2 accidents where I couldn't reach the toilet in time. This is really affecting my lifestyle and limiting my outdoor activities, as I am always anxious of being caught short. Even if I do go out, I always must plan my activities and be aware in advance where all the toilets are so that I could avoid any mishaps.
Okay. Do you also get up at night, or do you have a sensation that you have not emptied your bladder fully?
Certainly, doctor. I started to get up at night in my late 40s for at least 1 time, but now I get up between 2 to 3 times on average. And I often feel that I have not emptied my bladder fully.
Okay, let's do a flow test, and I could afterwards scan your bladder and examine your prostate.
Okay, doctor, what is a flow test?
A flow test involves you passing your urine into a special device, as shown in the picture, which measures electronically how fast your urine is expelled. After you have emptied your bladder into the flow rate device, we normally use an ultrasound bladder scanner to see if your bladder has emptied fully. Okay, thank you for doing the flow test. You achieved a maximum flow speed of 8 milliliters per second and an average flow of 4 milliliters per second. It took you 53 seconds to empty a volume of 189 milliliters of urine. On scanning your bladder, unfortunately, it looks like you have 250 milliliters of urine left behind after voiding. Your prostate feels enlarged on digital rectal examination, but it is smooth and benign feeling. This strongly suggests a condition called bladder outlet obstruction. Your flow speed is below 10 milliliters per second, which is associated with bladder outlet obstruction in 90% of cases, and you do not empty your bladder fully, which is also another sign of the same condition.
What is bladder outlet obstruction?
Bladder outlet obstruction is a generic term used to describe a blockage to the flow of urine when it leaves the bladder. The most common cause of the blockage is prostate enlargement. This could cause symptoms of poor flow, a delay in initiating the flow, and a stop-start pattern of the stream, as well as other symptoms like small dribbles of urine after finishing, a sensation of incomplete bladder emptying, and an increase in the frequency of urination as well as sensation of urgency.
My GP did a blood test called PSA. What is this?
PSA is a glycoprotein enzyme produced by the prostate, and its function is to liquefy the ejaculate, enabling fertilization. The PSA could be raised in cases of prostate cancer, but there are other causes that can raise the PSA like benign prostatic enlargement, retention of urine, and infection. This table here shows the normal values of the PSA for different age groups.
Could the symptoms be caused by prostate cancer, doctor? I am hearing a lot of that in the news lately. I even have a couple of friends who were recently diagnosed with prostate cancer, and I am really concerned about having cancer.
Your PSA blood test is 2.3, which is normal for your age, and your prostate feels completely benign on digital rectal examination. Therefore, the chances of having prostate cancer in your case are very small. Please be assured that most waterworks symptoms are not caused by prostate cancer. They are caused by benign enlargement of the prostate, as the latter affects the exact area where the water pipe passes through in the center area of the prostate. This enlargement compresses the urethra and causes the voiding difficulties you are describing.
Why do I have to rush to the toilet if this is a blockage problem?
Rushing to the toilet is described as urgency, and this is caused by an increase in the pressure inside the bladder during voiding. This increase in the pressure may lead to damage to the small nerve fibers inside the bladder, which gives rise to the symptoms of urgency and frequency.
Thank you, doctor. Is prostate enlargement the only cause of my symptoms? Could there be another cause?
Of course there could. There are other rarer conditions that could give similar symptoms to yours. These include high bladder neck and bladder failure. In high bladder neck, the angle between the bladder and the prostate is acute, which causes obstruction to the urine flow in a similar fashion to prostatic obstruction. In bladder failure cases, the bladder itself is weak, and this can also cause a weakness in the flow in the absence of obstruction.
How common is prostatic enlargement?
The prevalence of prostatic enlargement increases from 8% in men aged 31 to 40, to 40 to 50% in men aged 51 to 60, to over 80% in men older than age 80.
Thank you, doctor. I really understand my symptoms much better now, and I look forward to some treatments for my condition.
In the next video, we will continue to talk how to manage Gary's symptoms and what treatment he could be offered. I hope you have enjoyed this video and you found it educational. If you did, please like, share and subscribe to help grow the channel.